You're listening to the La Jolla Cosmetic Podcast with Monique Ramsey.
Hi, everyone. I'm Monique Ramsey, and welcome back to the La Jolla Cosmetic Podcast. This episode is going to be a little bit different. 5 years ago, we sat down with our founder, Marie Olesen, for our very first episode, and I really had no idea what we were starting. 230-something episodes later, here we are. So to mark 5 years, I went back through the archives and pulled 5 of my favorite moments, one from each of our surgeons. It's a countdown. So we're starting at number 5 and working our way to number 1. And then I have one more thing for you at the end, the actual greatest moment in the 5 years of this show. You'll want to stick around for that. So, all right, let's get into it.
When we do a brow lift, and I do a lot of brow lifts, and I think it's a wonderful operation on women, not on men. It is an incredibly feminizing operation. And see, he looks surprised.
He does.
He looks surprised. And, you know, when I evaluate a brow lift and I talk to my patients about who are considering brow lifts, we divide the eyebrow into 3 regions, the inner region, the middle region, and the outer region. And if the inner region is down, you look angry.
Okay.
And if the outer region is down, you look tired. And the middle region, you don't really want to change, because if you elevate the middle region, you look surprised. And he looks a little surprised here.
He does.
So maybe he was surprised that he got the award.
That was Dr. Brahme earlier this year, breaking down what actually happened to Jim Carrey's face and why brow lifts on men are almost always a bad idea. Coming in at number 4, our facial plastic surgeon, Dr. Kiersten Riedler, and a moment that has absolutely nothing to do with surgery and somehow everything to do with surgery. Take a listen. If your surgical results were a cookie, what kind would they be? Crisp and classic or soft and a little spice?
I'd say soft with a little spice. Because...
And why?
Well, because to me, like crisp and classic, I don't know. I feel like that's how people think of gingerbread, but nobody likes that kind of gingerbread. Mm-hmm. And maybe the same thing with facial plastic surgery. It's like kind of harsh and, done is like not really what we're going, like most patients want and what I try to deliver. So I think soft with a little spice is more like soft, natural, beautiful. Mm-hmm. Results. Mm-hmm.
Well, we are going to put in the show notes some information about, if you're thinking about having any facial plastic surgery, which really is, she does everything from, really from the clavicle up. So that's, if you want to like think about if it's a breast lift, it's not going to be Dr. Riedler. Yeah. But if it's your ears, your nose, a face, eyes, brow, fat transfer to the face, I think you'll see, we'll put in the show notes links to her gallery, because you'll just see how natural her results are. And I think that your point about it's not done or overdone, you just, some things seem extreme, and yeah, you want a noticeable difference to rewind the clock, but you don't want to be like, screaming like, hey, everybody, look what I had.
You want to look better without people knowing why.
Yeah. Soft with a little spice. That's Dr. Riedler in a nutshell. So number 3 is from our podcast with Dr. Diana Breister. And it's one of those moments that reminded me why we make this podcast. Because patients come to us with things that they're embarrassed to even bring up with their gynecologist. So sometimes the best part of plastic surgery isn't what you see, it's what you finally don't have to think about anymore.
After about 3 to 4 weeks, when the tissue has settled down, they are absolutely thrilled. They basically walk into the office just almost with a skip in their step. There is a change. They feel more confident. It's almost like a sigh of relief. They're like, oh my God. I'm so happy. Like, I'm so happy that's gone. It really emanates from their whole presence a lot, which is kind of, strange, but it's true. We are a function of how we feel about ourselves, and if that's just a source of like, a little ick that you don't really like, once that's fixed, even though you're not, showing that to anybody, it doesn't matter because you just feel better. And that I think is the number one reason why I'm actually in this field is just to, help women feel the very best they can.
Dr. Breister on why women walk back into her office with a skip in their step. Number 2 takes us into a little different territory. Dr. Luke Swistun has been our breast implant removal specialist since day one, and last year he sat down with his wife, Dr. Dominika Swistun, a clinical psychologist and sleep specialist, to talk about something that doesn't really get talked about anywhere else, which is what happens to women mentally after they've had their implants removed. The story he tells, I think about this story all the time.
The simplest example is a very extreme situation where a very young patient presented to my clinic to remove her implants specifically because of anxiety. She basically developed intractable anxiety after her augmentation. Now, this is sort of in my, looking back, this is sort of the perfect storm patient, so to speak. She's young, she's very thin, she's very tall, and she wanted to go really big. So she went with 600 cc implants under the muscle, which are large implants under the muscle, which will feel very tight. And then because she was very thin, she was really feeling that pressure. And she actually she said that she already had some pre-existing generalized anxiety disorder. Nothing very serious. There was talk of maybe treating her for it, but her psychiatrist at the time never really recommended treatment yet. Hey, just watch it. Here's some rescue, techniques. When you start feeling panicky, take some deep breaths, calm down, and here's some Xanax for breakthrough panic attacks in case you need it. After her augmentation, she said this basically just completely got out of control. She woke up after surgery in recovery and immediately had a panic attack. She was like, "Oh my God, this is so tight. I can't breathe. I can't breathe." The staff called the doctor over and the doctor examined her and it's like, You're fine. These are just large implants. You're going to adjust to them, get used to them. And she literally told me like she never did. That never really happened. They always felt tight. They always felt heavy. They always felt like she was closed in and claustrophobic and she couldn't breathe. And this affected her life very quickly, very significantly. Like she went from a normal functioning person to completely disabled in about 6 months. She saw 2 psychiatrists. She was maxed out on SSRIs with a short period of time. She had a lot of Xanax on hand and she was using 3 to 4 pills every single day just to get through the day because of how many panic attacks were getting triggered in her life. And within 6 months, she was on full disability from work for intractable panic attacks. That was the cited diagnosis. And she basically made the observations like I can't live like this. I didn't have it this severe before I had an augmentation. And I love my implants. I love my result, but I cannot live like this. So she presented to our clinic 9 months after her original augmentation. So she didn't even last a year with those implants. And her symptoms got so severe, she basically said, "Can you just get them out?" So we went ahead and did that. And by the way, no other symptoms, no chest, shoulder, back pain, nothing else, just anxiety. That was literally the only reason she wanted to remove them. And when we removed them, she woke up after surgery in my recovery room, and she was like, "Oh my God, back to normal. I can breathe again. I can feel like I'm so much lighter, and stuff like that." So it was an immediate improvement in her physiology or in how she felt. And then obviously we have a very strong follow-up with our patients. So I saw her 2 days after the surgery, a week after the surgery, 3 weeks after the surgery, 3 months, 6 months. And every single time at every single milestone, she was like, "I'm back to normal, no panic attacks," and things like that. The biggest milestone was at the 6-month mark after we explanted, where she basically comes back and says like, "Well, I'm down to like my original psychologist, and he's actually weaning down my SSRI dose. I think we're going to get off of it next month. So I won't be on that medication anymore. I'm fine. Here's my full bottle of Xanax. I have not used any of these since we explanted. You can see the expiration or the refill date. I haven't refilled these. I was using 3 to 4 a day with my implants, and I haven't used them since we explanted at all. And I'm basically back to normal. I'm back at work. I'm normally functional."
Okay, that was Dr. Luke Swistun telling the story of a young woman whose entire life turned around the day her implants came out. And we've made it to number 1. Of every moment of 5 years of this podcast, this is the one I think every single person considering plastic surgery anywhere in the country, not just here, needs to hear. It's from Dr. Hector Salazar. One question that tells you whether the surgeon sitting across from you is the real deal.
It's funny because one question that it's key for patients that they're not sure if their surgeon is the real deal. The one and only question would be, for instance, we're going to do a breast augmentation, right? So you would ask the surgeon, Dr. Salazar, you're telling me we're going to do a breast augmentation. If I would ask you to do this breast augmentation that you're going to do in your surgery center, do you have privileges at a hospital to do this surgery? Meaning, could you do my surgery at a hospital? Are you privileged by Scripps, by Sharp, by Kaiser to get that surgery done at that hospital? And that question differentiates a oral maxillofacial surgeon placing implants, because that person would never, ever be privileged at a hospital where things are very much regulated to be able to put breast implants in. And believe it or not, that happens. So that question is, can you do my tummy tuck? Do you have privileges to do it at the hospital? If that doctor is a OBGYN doing tummy tucks, that doctor would never have privileges at a hospital to do a tummy tuck because that's out of the area of his expertise. So I think if there's one question to ask at the end of any consultation, say, Doc, what you're going to do, the surgery that you're planning, can you execute that surgery at a hospital if we would need to? Are you privileged at a hospital? And then if you still have your doubts, if you ask me, can you give me a letter stating that? I would, and I'll be very happy to do it because I can.
Yeah. That's it. That's the question. If you remember nothing else from this episode, remember that question. But here's the thing. When I went back through the archive for this list, there was one moment that I couldn't put on the top 5 because honestly, it didn't belong on a list. It belongs at the end. And when I started this podcast back in 2021, the very first guest was Marie Olesen. She's been at the heart of La Jolla Cosmetics since the beginning. And on episode 100, she came back and she brought her husband, our founder, Dr. Merrill Olesen, with her. And I asked them how it all started. And here's what they said.
Well, I remember a couple stories. One is that cosmetic patients in 1988 were still embarrassed and sort of wondering if they were doing the right thing. And so someone came in to have her talk about having her eyes done, and she was sitting in a waiting room with sick people. And she came in, and Merle came home and told me that she said, I wanted to have my eyes done, but sitting in your lobby with all these sick people, I need to get a life. And so that was a problem. And then when it came, you have to give a fee estimate. So they had to go into a bullpen of secretaries, and 4 people were overhearing whatever the patient was going to have. And the patient was reluctant about having it. And so their need for privacy was much greater than it is now. So those are just 2 examples. I would say the third is that there wasn't a real consensus in plastic surgery nationwide that the cosmetic patient was a legitimate patient. In other words, someone who's sick deserved the care of these esteemed and highly trained specialists, but the person who was being driven by emotional needs or appearance was somehow second class. And he saw all that and felt it was wrong and wanted to get into an environment where he could take care of patients in the way that he felt they needed to be taken care of.
That was Marie Olesen in 2023 on our 100th episode, telling the story of a patient in 1988 who said, I need to get a life, and the husband who decided that that patient deserved better. 5 years of this podcast and almost 40 years at LJCSC, that's still the whole reason why we're here. Thank you for listening, and to every patient, every surgeon, every guest, every team member who's shown up for this show, thank you. We've got plenty more coming, and we'll see you next Tuesday.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to LJCSC.com or follow the team on Instagram at LJCSC. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.